So very good morning, Kalimera, everybody, and thank you for the opportunity to present the following presentation on behalf of PIF. I am here to tell you the main findings about a study that was performed earlier this year under the heading Greek Citizens Express Concerns over Healthcare Services and Access to New Innovative Medicines. So first, couple of words about the study itself. This study was performed by a company called Alco, and it was ordered by the PIF Pharma Innovation Forum. It was done as a telephone interview for 1,000 Greek citizens all over the country, and it was performed early March this year. So during the following 20 minutes, I will walk through the most important findings of this study, but not only the findings. I want to put the findings into the context of healthcare and real-world data around the world. So let's start by looking at what's the common understanding and opinion of Greek citizens about the healthcare system. I have to start with quite alarming number that 6 out of 10 Greek people believe that the level of healthcare services in recent years have declined significantly. And on the contrary, only less than 10% of people have seen some improvement in the system. So why is this happening? We do know that the investment, maybe for good reasons, to a certain extent, have declined significantly over the last years. And the ratio of investment of GDP into health has declined. And at the moment, the investment in Greece is half of the OECD average. So I guess we can say that you get what you pay for. When people were asked in what is in their mind the most important area to invest money, typically when this question is asked, education is always number one. Regardless of the country and situation, education comes as number one. So this is actually a very interesting finding, that in this survey, health actually is even above education. And this underlines the importance of health for Greek people and their understanding that there is a lot to do to fix the situation. A very alarming number here, that 8 out of 10 people believe that their own pharmaceutical medicine needs are not covered. So 81% of people think that in their daily life their pharmaceutical need is not covered. And again, there is a clear reason for that. The pharma budget has decreased by 60% since 2009. At the moment, it is fixed, the retail budget, to less than 2 billion euros per year. Absolutely, that is not enough. What is the right amount? Probably we don't need to go up to the numbers of previous years, but more money is needed to treat the population of Greece. Additionally, it's not only about the money, it is how you use it. And you heard from the previous speakers very good points that there are many ways already now there to do and to use the money more efficiently and to produce better outcomes for patients. When we ask people what do they think or what comes to their mind when we talk about innovative medicines, they have actually a pretty good understanding what it means. Number one is that they increase life expectancy. The second one is easier drug administration. Third one, fewer surgical procedures, followed by fewer disabilities. So we can say that there is a good understanding that new innovative medicines have a positive impact, both in health but also quality of life. Is this then true? There's a lot of data to prove that actually the perception of Greek citizens is exactly the correct one. Nowadays, 2 out of 3 people diagnosed with cancer, all cancers, survive at least 5 years. If we take the most common cancers of men and women, prostate and breast cancer, 9 out of 10 people diagnosed survive over 5 years. So these diseases that were considered to be a life sentence or death sentence, they have became chronic diseases which are pretty much manageable. And also if you look across geography, there are many countries with very consistent decline in all cancer mortality. So clearly, life expectancy can be changed with new treatments. So when people were asked to say what do they think will be the consequence if we delay access to new treatments, which is going to be the consequence of the new measures as we just heard, 6 out of 10 people believe that delaying access to innovation is either a public health danger or downgrades Greeks to B-class citizens. This is quite a strong statement, and the question is this only a pessimistic view or perception? There's again data to prove this one. Healthcare spend and coverage has a very direct effect on life expectancy. If we take European countries and we group them based on the healthcare spend and life expectancy at birth, we can roughly group countries to 2. Greece at the moment, and based on the history, 90s, early 2000s, Greece belongs to the, I wouldn't like to say upper class or premium league, but still to the Western European countries. We have heard many times this government saying that yes, we can implement these measures because they are implemented in Eastern European countries as well. Yes, these measures can be implemented, but the person or government who does that must also be ready to carry the consequences of decreasing the life expectancy of people. So what is the role of pharma companies in healthcare? 6 out of 10 people believe that we play an important role in defending public health. And that is very true. We have knowledge, we have will. Not very often you hear, like you hear in Greece and even this morning, that pharma companies, we are pushing and hoping to get more structures in place to sometimes prevent, sometimes allow drugs to enter a country, but in a structured way that values innovation and outcomes. We are not hoping to go back to the old. We want to have a system that really supports outcomes. Over the last decade, life expectancy has grown by 1.75 years. And we do know, and we have to always remember and respect, that treating illnesses is a multidisciplinary thing. So there's diagnosis, there's surgery, in cancer we have radiotherapy, and so on and so forth. So this is not only about pharmaceutical treatments, but what is important, that 73% of this improvement in last decade actually comes from new innovative medicines. So conversely, if these treatments and innovations doesn't come to a country, it is easy to figure out what happens to this number. Of course, first, we should always think about people's health and outcome, as we just did. Additionally, of course, we have to take into account also money. So often we hear new expensive medicines used together, these two words, and that should be not done. There are also old and expensive medicines. There are old medicines that shouldn't even be in the market. There are maybe some new medicines that are expensive. What we should talk about is the outcome and the cost effectiveness of these treatments. Let's take some examples. Vaccinations were already mentioned. They are, of course, when they do their job, the most effective and cost-saving way because we prevent illnesses. So by annual influenza vaccination in Europe, we have been able, or the society and industry together, we have been able to prevent up to 2 million influenza cases. And this translates into savings up to 330 million euros every year. Definitely cost effective. But also when we look more traditional treatments, and let's take cardiovascular diseases and the historic perspective there. Since mid-1990s, when statins and other new treatments, the previous wave of new treatments were introduced to cardiovascular disease, in 20 OECD countries, by investing $24, this is not dollars but euros, per person, the society was able to produce savings of $89. And this is exactly what we mean when we talk about innovative treatments as investments. They are not cost if they are used in the right way and right patients by correct physicians. They are investments and they are worth putting the money in. But we can go even beyond the healthcare cost, because when people are treated correctly, they either stay active and they can still work, they can remain at work maybe 20 years more than without treatment. And this is, of course, this starts to be a macroeconomic view of single person's health, but it's worth also thinking that there's a positive impact in this one. Let's take rheumatoid arthritis patients, and this is a study over 2 years, only 2 years treatment with, at that time, novel biologic treatments compared to conventional therapy. During only 2 years, 24 months, the patients who received the innovative treatment, they were able to work 31 weeks longer, and they earned 26,000 euros more. And if, maybe we had to say if you pay taxes for that, you can imagine what's the impact on country or society level. So we are also talking about productivity when we talk about efficient treatment of patients. There are also some misconceptions, unfortunately, about who pays what and what's the role of innovative pharma. We heard a wish from Mr. Papataxiarchis about the uninsured patients, and they should get a separate funding. So when we ask from people, who do you think pays for uninsured patients and refugees, half of the people think it's state, and so on and so forth. Actually, it is the industry who pays for these patients. And without going to the details about what is retail, what is clawback, what is rebate, the fact is that, as you already heard, industry pays already 1 out of 4 drugs in retail and 1 out of 3 drugs in hospital, or we give for free. The austerity measures on us reached 1 billion euros last year, and the pharma budget is 2. So when we summarize the findings, we can say that clearly the Greek citizens have a good understanding of the situation, and they are really worried. They do express their concerns regarding healthcare services and access to innovative medicines, because 6 out of 10 people believe that healthcare services are significantly declining. 8 out of 10, as you remember, probably believe that their pharmaceutical needs are not covered. And again, 6 out of 10 think that delaying access to innovation is either dangerous and or weakens Greek citizens. So have we reached the bottom at the moment? Unfortunately, it looks like we haven't. If the new measures that has been drafted and leaked out and announced but not legislated yet, if they come through, it doesn't only mean that there's intended or unintentional delays to medicines. It really honestly can and will mean that there will be many treatments that will be introduced in other countries but not in Greece. It makes Greece an unsustainable business environment. The rebates and clawbacks, as you heard, may reach up to 50 and to 60% of a drug. And this is something that just absolutely cannot be tolerated in an industry which is really investment heavy and high risk. So if these measures are really implemented, what has to be then considered is that are we, are you, are they willing to take responsibility of putting Greece and the patients, the citizens of Greece, from the current league where we are in healthcare and life expectancy to the company where I don't think anybody wants to belong to. So this is now really a time to have call for action to involve both BIF, SFE and companies to discuss about the measures. There are ways to use even the existing money more efficiently. So I would like to end up with an English saying, where there is a will, there is a way. Thank you very much.